What is metatarsalgia? Well, it's a condition characterized by pain in the forefoot, which some people call the ball of the foot. And the actual term itself is a combination of meta, as in metatarsal, which is the bones that lead up to the toes, and algia, which just means pain in a specific area. So it's pain associated with the bones in the forefoot. What are the symptoms that are typically associated with metatarsalgia? Well, the defining symptom is pain in the forefoot. It's often aggravated by standing and walking, and it can be particularly troublesome when standing on a hard surface. There may also be swelling, and in some patients they'll get a sense of burning into one or more of their toes. The symptoms are usually located at the base of the second toe and or the base of the third toe. And often the symptoms will be started by someone who has, for example, increased their activity level or changed their shoe wear. What causes the metatarsalgia? Well, metatarsalgia is fundamentally caused by loading, repetitive loading to a concentrated area. In many people, force over the front of the foot is not distributed equally. There's some areas that take more force than others. So just imagine part of your foot being struck repetitively with a hammer over and over again. And that's essentially what happens in metatarsalgia. And the tissues in that area get chronically injured. So that includes the prominent bone, which we call the metatarsal head, includes the capsule that surrounds the joint in that area that can get inflamed and angry and swollen. And it can even involve the digital nerves as they extend into the toes, and so they can get irritated and have numbness and burning. So repetitive load to the forefoot is what precipitates the metatarsalgia. How is metatarsalgia diagnosed? Well, it's diagnosed by taking history and doing a physical exam. And the physical exam is critical. Essentially, you look for areas of tenderness in the forefoot, and typically you'll see them at the base of one or more of the toes. And that, possibly associated with some swelling and maybe even some looseness of the joint, is pretty typical for metatarsalgia. X-rays can be helpful. They may show that the metatarsal bone is longer, which is something we know is a risk factor for metatarsalgia. In addition, there's certain devices that will look at how weight is distributed across the front of the foot. And these may show an increased load through part of the foot, which is also consistent with the diagnosis of metatarsalgia. What else could cause this type of forefoot symptoms? Metatarsalgia is actually a general term that covers a variety of conditions that cause forefoot pain. So for example, a Morton's neuroma. That's an irritation to one of the nerves that leads into the toes. It can lead to pain in the forefoot and burning. It's a type of metatarsalgia. But not all metatarsalgia, in fact, not even most metatarsalgias are Morton's neuromas. They're usually from other sources, such as irritation of the joint capsule or chronic injuries to the tissues in that area. One cause of forefoot pain that is not from metatarsalgia is actually a stress fracture. Stress fracture involving one of the metatarsal bones. And that's usually more symptomatic. Patients often have difficulty or are unable to weight bear at all. So how do we treat metatarsalgia? Well, there's an initial treatment to try and get the symptoms to settle down, and then there's ongoing management. The Initial treatment is to avoid any inciting activity. If there's been an associated increase in activity, you want to decrease that. Stay off your foot as much as you can. One of the main hallmarks of this is activity modification. So you want to look for ways to decrease the repetitive loading through your foot. So if work or life activity requires lots of standing, maybe in the short term you look for ways to decrease that. Comfort shoes can be very helpful in treating metatarsalgia. Shoes that have a fairly stiff sole and a rocker bottom contour, a nice soft area surrounding the toe box, those can all be helpful in alleviating the symptoms of metatarsalgia. Another thing that can be very helpful is a appropriate insert, either a over-the-counter soft insert or a custom insert, something that is soft and shaped in a way to allow force to be dispersed away from the painful area. Also, a metatarsal pad that can be built into the insert or can be applied separately. And if it's positioned in the right place, it can really help offload the area of pain and can be quite helpful in controlling symptoms. Anti-inflammatory medication, if there's no contraindications, can be quite helpful in controlling the symptoms of metatarsalgia. This is often taken in the short term for a few weeks or a month to get the symptoms under control. Another option, which is not done that commonly, but in the right situation can be helpful, is a corticosteroid injection. And that can help control the pain in the short and intermediate term. Surgery is rarely indicated for metatarsalgia, but occasionally there are patients that have symptoms that just can't be controlled by non-operative means. And in those instances, there are some surgical options, for example, shortening the metatarsal bone. A lot of times the surgery will be combined with another procedure, for example, correcting a claw toe or correcting a bunion. And in those instances, this can be quite helpful. Pain in the forefoot from any of the conditions that fall into the category of metatarsalgia can be chronic and debilitating. However, by understanding what the issues are and by taking a methodical approach to treatment, a successful outcome can be obtained.